sharing that. So we want to shift gears a little bit into another conversation, something that I knew that you were interested in based on your biomedical cannabis.
Mm-hmm. So
What
yeah,
and what
sorry.
and how did you know about that? You're
Yeah,
interested in?
that's yeah, definitely interesting story. So I'm a pharmacist by training. I went to Howard University for undergrad and for my doctorate in pharmacy degree. I did the 6-year doctorate program. So I was there from 2008 to 2014. Um, Graduated in 2014, moved back to New York. I've done a little bit of everything in pharmacy, to be honest. Pharma is like the one thing I haven't done just yet, but I think this is my pathway to it, to be honest. So I was at CVS for a little bit, community pharmacy. Then I did health system management for a little bit. I was a supervisor at a hospital, moved to a tech startup. And then when I was at the tech startup for a few months, another pharmacist in the organization I'm in a pharmacy fraternity called Kappa Psi. They were leading the same organization around the same time as me to be the pharmacist in charge at a medical dispensary. So what's unique is that in New York, medical cannabis, the way that the law is structured, every medical dispensary requires a pharmacist to be on site and on staff. In the majority of those locations, the store manager, the pharmacy manager is who's leading the entire operation. Um, and it's because we understand that cannabis is a medicine and it's truly like creating a clinical environment. The other states that are like that are Connecticut, New York, Louisiana, Arkansas, Pennsylvania, Ohio, and Virginia. So those are all states that there's a clinician or specifically a pharmacist involved. Maryland requires like a clinical director. So the pharmacists that work at the enterprise level for organizations in Maryland as well on the medical side, the clinicians. But for me, it just that was the thing that clicked. I've always been into integrative medicine. When I was at Howard, I took the natural medicine elective, right? All of the pharmaceutical products, I mean, not all, but a lot of pharmaceutical products that we utilize are based on some type of natural product that they were originally discovered from. I think culturally, we've always had natural medicines included in how we take care of our health, whether it's a tea your grandmother would make, etc. But I think there's a beauty in understanding the science of it. And then for me, with medical cannabis, was also understanding there was a lot of misinformation about cannabis that was put out there too. So the science of it was a way to decriminalize, right, destigmatize the plant, and also destigmatize, I think, the people that were associated with utilizing it, especially if they were utilizing it and didn't recognize it. So, got into the science, really loved it, learned about the endocannabinoid system, a system that's a part of our nervous system that has been discovered in 1990, but we still don't learn about it in schools, right? The only people who really talk about it or learn about it are PhDs in like neurology and folks who are really in that space and experts in science of the brain and the nervous system. But integrated systems in our body that helps us maintain balance and homeostasis, right? The body produces cannabinoids of its own, but then with this plant, we have access to the similar compounds that can help to modify the system and help get us back into balance and give patients some relief, potential relief at times for different disease states without some of the heavy side effects or adverse effects that come from other products. So it's it's a new industry. I think I'm not afraid to be at the forefront of things or doing something new. It may not feel safe at first, but as things catch up, more opportunities come. So you see the recent executive action to reschedule cannabis, which is going to open up research, which I think will open up more opportunities for farmers in this space and more opportunities for other clinicians to get into it. There already is and having medication on the market, right? Like different cannabidiol. The proof is there. There's history there. There's the anecdotal data there. But now again, I think we can get some more science.